A lot of constituents that I serve back in Nevada who are, staying up late at night, can't sleep because of the cost of their health care and whether or not they can even access it. This has been a choice to cut $1 trillion out of the health care system. It's been a choice to not renew the enhanced premium tax credits. It's been a choice to not make some of the reforms that you're talking about here today. And I hope that since the majority has decided that this is an opportunity for us, I'm focused on what you said, Ms. Young, which is what can be done in a bipartisan way to address the needs of the American people around their need for accessible, affordable health care. So I want to give you a moment to speak directly to the people in this room and who are watching this hearing. You opened up in your remarks talking about what it means as a small business owner who has the responsibility to provide health care, as a breast cancer survivor, as a widow, what this issue of health care access and affordability means. So I just want to give you a chance to talk about that, and especially in this moment when we have the president focusing on directing billions abroad to Venezuela and to Argentina, to talking about Greenland, while you and your family and your business struggle to have access to health care.
Right. Thank you. So the first thing I'll say is I believe you always take care of home first. So if I haven't mowed my own grass, why am I going to go and mow my neighbor's? And so you always take care of home first. So when I think about the whole issue of healthcare and us all being here, I really want people just to see the humanness behind all of this and to see that there's so many people like me who work really hard and we contribute so much to our communities. We provide jobs for other people. We really enhance the economy of the places that we live. And when we don't have the things that we need, it really threatens us being able to provide all of the benefits that we are. So for myself, being a breast cancer survivor, if that outcome were different, how many people would not have a job because I can no longer employ them because I'm no longer here? There's such a ripple effect for not having the care that we need, not having a healthy society. So when I think about our president who is looking outside of the United States before taking care of home, that's not acceptable. You always take care of home first. And when I think about just the back and forth of health insurance companies and pharmaceuticals and all of the people who are looking more at profits than people, it's really disheartening and hurtful. Thank you.
Well, centering your voice in this debate, and I'm so thankful that you're on this witness stand today. We have a lot of prestigious executives who are here, but the most important person that we heard from today is you, because you represent millions of people who are just trying to get by and who are trying to survive, who are trying to create opportunity for themselves, whether it's as a business owner or for their family. And I think when we center the voices of the people, when we listen to you, when we lift up your lived experiences, and when we learn from you, we can make healthcare better for everybody.
Thank you.
Now, unlike some of my colleagues on both sides of the aisle, I have long supported Medicare Advantage. I have been a champion for its integrated approach into our healthcare system, and I believe in giving choice to my constituents. So nearly 60% who have decided to enroll in Medicare Advantage as their healthcare option. But across policy areas, I gotta say, I have consistently heard from people that we need to make improvements. So Mr. Hemsley and Mr. Joyner, I wanna thank you for the conversations that we've had. They've been productive, but the concerns that I hear from seniors and providers suggest that Medicare Advantage too often works better for insurers than for the people it was designed to actually support. So I want to just give you an opportunity to talk about ways that we can work around transparency, around prior authorization, and around supplemental benefits like dental, vision, transportation, and meals to improve that quality of care under Medicare Advantage, and what we collectively can do in a bipartisan way to provide those benefits to Medicare recipients.
Well, Congressman, I completely agree that Medicare Advantage is a modern form of care, and using value-based care principles within it really allows that population who are engaged to really be under the direct care of the clinicians, and the clinicians make the decisions with respect to their care plans, how they're overseen, how they use resources. There's not the, in those situations, the clinicians are responsible for those individuals. They're paid a rate for each one, and they make the decisions. And we think when they're incented that way, that they make good decisions, they're good practitioners, and they get good outcomes. So we think value-based care, and Medicare Advantage is a perfect platform for that, is a really good example of what the future of healthcare could be here, and where resources are used in a more virtuous way under the oversight of practitioners who are incented to maintain health and get outcomes as opposed to drive volume.
I know my time is up, but I want to follow up with you, Mr. Joyner, and with all of our witnesses. I hope that, if nothing else, we can agree that healthcare should be improved, it should be more affordable, and it can be more accessible, and all of us have an obligation to the people that we represent to make that a reality. So thank you, Mr. Chairman. I yield back.